So in terms of breathing issues, this is probably the most common reason that I see patients for rhinoplasty in my office. Obviously, if you're not breathing well, it's an issue with your daily activities, especially if you exercise. For a lot of patients, it's an issue at nighttime when they're sleeping, being not able to breathe through their nose and just snoring, which is also uncomfortable. But typically with breathing issues, there's something structural about the nose that's different that makes you not breathe well. And there's two major categories of this. One is things that are physically in the way of your breathing, such as a deviated nasal septum is most common that all of us know. Second one would be enlarged turbinates, which are structures inside the nose that help us humidify air as we breathe, but they can also get very large and obstruct airflow. Finally, the second category of disrupted breathing is dynamic airway collapse, or what's known as vestibular valve stenosis is the fancy term. And that's just you breathe in quickly and one side or both sides of your nose collapses shut. Frequently we'll see this in runners or people that are in very heavy duty exercise activities where you breathe in quickly, the nose caves in on itself because the sidewalls aren't supported well enough. And this typically is examination and an interview with you to just get an overview of how you're breathing, what your issues are, whether it's crooked nose, physical obstruction of airflow, or dynamic collapse, and coming up with a comprehensive plan to address all of those issues. Some patients, if they just have a septoplasty, may get in trouble because they now breathe faster, but now their nose is caving in. And it would be nice to know if you're prone to have that happen before you have just a septoplasty performed, because there's things we can do during the septoplasty to prevent that nose from caving in and just ensure that your breathing outcome is optimal for the anatomy that you're presenting with or the injury that you're presenting with.